Professor Anand, this approach is not perhaps a traditional economic approach. You've taken a sort of a wider scope here. Can you talk about that?
About that specific thing?
Yeah, or if, yeah, as you
okay. Well, the cost of inaction is not the cost of doing nothing. It's the cost of not doing some particular thing, because there are certain negative events that you can't avoid by any action. For example, a tsunami or a volcano erupting or something. So where one observes negative consequences, as both the previous panelists have pointed out, in the case of addressing problems that confront children, and in this book we examined, to begin with, problems that affect children who are in extreme poverty and or also are exposed to HIV/AIDS through their parents or through the community. So are there actions that can be taken to avoid the negative consequences? And if so, then in evaluating those actions, we must take account of the negative consequences that have been avoided, which would otherwise constitute costs to the society, to the individuals concerned, to the economy, to the community, and so on. So the idea here is not simply to appraise a intervention, be it a health intervention, in terms of the constitutive health benefits, such as reducing ill health or infant mortality or sickness, but also the consequential benefits that if a child is not ill, he or she is likely to do better at school, to attend school first of all, and then to learn better, and so on. And these are quantified in through the use of some of the studies that have been done in different contexts in the development economics literature. So, so one aspect is the taking account of actions in one area or sector, their consequences in another area. The second is, as the minister was saying, children. You see, if you don't act early in terms of children's, say, early childhood development, then the costs can be quite large and they may be irreversible. For example, if children are stunted, that's a condition that's rather difficult to reverse. If children's neural networks don't form, then that leads to serious consequences, again, difficult or impossible to reverse. So the costs of inaction will be large if there's serious harm from inaction. If the harm lasts over a long period of time, as it would in the case of children who have, generally speaking, expected to have longer life than, say, an adult, and say the costs rise over time and possibly even are irreversible. And in some cases, clearly they are irreversible. And for example, if a child dies, that's the ultimate irreversible consequence.